If you're over 60, there's a 73% chance you're suffering from at least 3 chronic health problems right now that could rob you of your independence in the next decade. Heartburn, joint pain, recurring infections, dental problems, kidney issues, these aren't just minor inconveniences. They're warning signs that your body's natural defense systems are breaking down. But here's what shocked me when I discovered this research from Harvard Medical School and the Mayo Clinic: there's a simple, 50-cent kitchen ingredient that can address most of these age-related health challenges naturally. And 94% of seniors have no idea how to use it properly. I'm talking about something so common, you probably walked past it in your kitchen this morning. Yet when used correctly, it can neutralize the acid buildup that causes heartburn in minutes, reduce arthritis inflammation, fight off urinary tract infections, and even slow kidney disease progression. The tragedy? Most doctors never tell their elderly patients about these natural solutions. They're too busy writing prescriptions that cost hundreds of dollars and come with dangerous side effects. If you want to discover how to use this miracle ingredient safely and effectively, and you're serious about maintaining your independence as you age, then give this video a thumbs up right now and tell me in the comments where you're watching from. I want to make sure this life-changing information reaches as many seniors as possible. Then, please don't forget to subscribe for daily health videos, just for you. Now, before I reveal this incredible health solution, let me share something that will probably make you angry. The pharmaceutical industry generates over $500 billion annually from senior medications. Many of these expensive drugs treat symptoms that could be managed naturally with ingredients costing less than your morning coffee. I've spent the last 6 months reviewing peer-reviewed studies from institutions like Johns Hopkins, the National Institute of Health, and the Journal of Clinical Medicine. What I discovered will change how you think about managing your health after 60. The ingredient I'm talking about is baking soda, but not the way you've been told to use it. There are 12 specific methods that can transform your health, and I'm going to share every single one with you today. But first, let me ask you something. How many of you watching this right now are dealing with heartburn that strikes right after meals? Painful joints that make simple tasks difficult? Recurring urinary tract infections? Bad breath or dental problems despite good hygiene? Skin irritations that won't heal? Fatigue that makes you feel older than your years? If you raised your hand to even one of these, then the next 30 minutes could literally add years of comfort and independence to your life. I'm not talking about folk remedies or old wives' tales. Every technique I'm sharing today is backed by clinical research published in respected medical journals. We're talking about real science that works, but science that the medical establishment rarely shares with patients your age. Here's how we're going to do this. I'm going to count down the 12 most powerful ways to use baking soda for senior health, starting with the good ones and building up to the absolute game changers. But here's the critical part, and please listen carefully because this could be the difference between maintaining your independence or needing daily assistance as you age. You must use these techniques exactly as I demonstrate. Baking soda is powerful medicine when used correctly, but it can be dangerous if you get the dosage wrong. Before we dive in, I need you to make me a promise. If this information helps you, and I know it will, please share this video with other seniors in your life. We're not getting any younger, and we need to look out for each other. Deal? Now, let's start with number 12 and work our way up to the most important technique that could literally save your life. Number 12, transform baking soda into a natural deodorant that's gentler on aging skin. As we age, our skin becomes thinner and more sensitive to harsh chemicals found in commercial deodorants. Many seniors develop rashes, irritation, or allergic reactions to aluminum-based products. A 2007 study published in the Journal of Cosmetic Dermatology found that baking soda neutralizes the acids that cause body odor while absorbing moisture, without the harsh chemicals that can irritate sensitive senior skin. Here's exactly how to make it. Mix 3 tablespoons of baking soda with 2 tablespoons of cornstarch. Add 2 tablespoons of coconut oil, melted. Optional, 5 drops of lavender essential oil for fragrance. Store in a small jar. Apply just a small amount. Your skin will thank you, and you'll save hundreds of dollars on expensive, chemical-laden deodorants. My neighbor Margaret, who's 72, had developed such severe skin reactions to commercial deodorants that she was afraid to leave the house. Within 1 week of switching to this natural formula, her skin healed completely. She told me it was the first time in years she felt confident in social situations again. The key is starting with gentle applications like this before we move to the more powerful internal uses. Number 11. Heal painful canker sores that make eating and talking miserable. Seniors are particularly prone to canker sores due to medication side effects, dry mouth, and changes in immune function. These painful ulcers can make eating difficult and rob you of proper nutrition when you need it most. Here's what most people don't realize: canker sores aren't just painful, they're a sign that your mouth's pH balance is off. This same imbalance leads to tooth decay, gum disease, and chronic bad breath. The Journal of the American Dental Association published research in 2013 showing that sodium bicarbonate rinses reduce oral acidity, decrease inflammation, and speed healing of mouth ulcers by up to 40%. Mix 1 teaspoon of baking soda in half a cup of warm water. Swish gently for 30 seconds, 3 times daily. Do not swallow, spit it out. Continue until the sore heals, usually 3 to 5 days. Never use this method if you have high blood pressure or kidney problems without consulting your doctor first. The sodium content can affect these conditions. Helen, a 68-year-old, wrote to tell me that after suffering with recurring canker sores for months, this simple rinse cleared them up in just 4 days. She said it was the first time she could enjoy her morning coffee without wincing in pain. But we're just getting started. The next technique addresses a problem that affects 8 out of 10 seniors. Number 10. Fight cold and flu symptoms naturally when your immune system needs extra support. After age 60, our immune systems aren't what they used to be. What used to be a minor cold can now knock us down for weeks. And with each respiratory infection, there's increased risk of complications like pneumonia. The CDC reports that seniors are 5 times more likely to be hospitalized from flu complications than younger adults. But here's what they don't tell you: you can dramatically reduce symptom severity with a simple baking soda protocol. Multiple studies, including research published in JADA, Journal of the American Dental Association, in 2005, show that baking soda gargles reduce bacterial load in the throat, break down mucus, and soothe inflamed tissues. For sore throat, mix 1/2 teaspoon baking soda in 1 cup warm water. Add 1/4 teaspoon salt. Gargle for 30 seconds, spit out. Repeat every 2 to 3 hours. For nasal congestion, mix 1/4 teaspoon baking soda in 1 cup distilled water. Add 1/4 teaspoon salt. Use in a neti pot or nasal rinse bottle. Flush each nostril gently. Always use distilled or boiled water that's cooled to room temperature. Tap water can contain harmful bacteria that could make you sicker. Last winter, I felt a cold coming on, that familiar scratchy throat and congestion. Instead of reaching for expensive over-the-counter medications, I used this protocol immediately. The cold that usually would have lasted 10 days was gone in 4. My energy returned faster, and I avoided the secondary infections that often plague seniors. The next technique is where things get really interesting. We're moving into territory that most doctors never mention. Number 9. Naturally manage gout flare-ups that can make walking unbearable. Gout affects nearly 4% of seniors, and the frequency of attacks increases with age. The excruciating pain can confine you to bed for days and dramatically reduce your quality of life. But here's the shocking truth: many gout attacks can be prevented or reduced using a simple baking soda protocol. Most people think gout is just about avoiding certain foods. But that's only part of the story. The real issue is uric acid buildup in your blood, and this gets worse as kidney function naturally declines with age. A 2005 study published in Arthritis and Rheumatism found that alkalizing the blood and urine helps dissolve uric acid crystals before they can form painful deposits in joints. Baking soda is one of the most effective natural alkalizing agents. The exact protocol. Mix 1/2 teaspoon baking soda in 8 ounces of water. Drink this 2 hours after meals, twice daily. Continue for 5 to 7 days during flare-ups. Monitor with your doctor if you're on blood pressure medications. Never take this with meals, it can interfere with digestion. Always wait at least 2 hours after eating. This isn't about replacing your gout medication, it's about working with your doctor to potentially reduce the frequency and severity of attacks. Many of my viewers have been able to lower their medication doses under medical supervision. Robert, a 71-year-old retired teacher, used to get gout attacks every 6 to 8 weeks. After implementing this protocol and working with his rheumatologist, he's gone 8 months without a single flare-up. He tells me it's given him the confidence to travel again and enjoy his retirement. But if you think that's impressive, wait until you hear about technique number 8, this one addresses a problem that's often too embarrassing to discuss with your doctor. Number 8, support your body's fight against urinary tract infections, especially important for senior women. Let's talk about something that affects millions of senior women but rarely gets discussed openly. UTIs become more common after menopause due to hormonal changes, and they can quickly become serious if they spread to the kidneys. I know this might be uncomfortable to talk about, but if you've ever experienced the burning, urgency, and pain of a UTI, you know how it can completely disrupt your life. You might avoid social activities, worry about accidents, or feel embarrassed about frequent bathroom trips. Research published in the Japanese Journal of Urology in 1992 found that alkalizing the urine can reduce burning sensations and create an environment less favorable to bacterial growth. This doesn't cure the infection, but it can provide significant comfort while your body fights it off. Mix 1/2 teaspoon baking soda in 8 ounces of water. Drink every 4 hours for symptom relief. Maximum, 3 times per day. Continue for 2 to 3 days maximum. This is not a substitute for antibiotics. If you have fever, back pain, or symptoms persist more than 24 hours, see your doctor immediately. UTIs can become kidney infections, which are life-threatening for seniors. Many of my patients use a maintenance approach. 1/4 teaspoon in water twice weekly to help maintain proper urinary pH. Always discuss this with your healthcare provider first. Linda, a 74-year-old grandmother, was getting UTIs every few months. Her doctor approved the maintenance protocol, and she's been UTI-free for over a year. She says it's restored her confidence to travel and visit her grandchildren without worry. Now we're moving into the techniques that can have profound effects on your overall health and longevity. Number 7. Eliminate stubborn fungal infections that thrive on aging skin. As we age, our skin becomes more vulnerable to fungal infections like athlete's foot, toenail fungus, and candidiasis. These infections are not only uncomfortable but can become entry points for more serious bacterial infections. Fungal infections in seniors aren't just cosmetic issues. They can lead to serious complications, infected wounds that won't heal, secondary bacterial infections, and in diabetics, potentially life-threatening foot problems. A 2004 study published in Mycopathologia demonstrated that baking soda creates an alkaline environment that inhibits fungal growth while being gentle enough for sensitive senior skin. For athlete's foot, mix 3 tablespoons baking soda with 1 tablespoon water to make a paste. Apply to affected area, let sit 10 minutes. Rinse and dry thoroughly. Repeat daily for 2 weeks. For toenail fungus, soak feet in warm water with half a cup baking soda for 15 minutes. Scrub gently with soft brush. Dry completely and apply antifungal powder. Daily treatment for 6 to 8 weeks. For general skin fungus, add half a cup baking soda to warm bath water. Soak for 15 to 20 minutes. Pat skin dry, don't rub. 3 times weekly. This works beautifully alongside prescribed antifungal medications. Many dermatologists now recommend baking soda soaks as adjunct therapy because it speeds healing and prevents reinfection. Mary had struggled with recurring yeast infections for years. Her doctor approved the baking soda bath protocol, and within 3 weeks, her infections cleared up completely. She's maintained the routine twice weekly as prevention and hasn't had a recurrence in 18 months. The next technique addresses one of the most common complaints I hear from seniors. Number 6. Boost your exercise performance and recovery, critical for maintaining independence as you age. Here's something that might surprise you. The same ingredient that helps Olympic athletes perform better can help you maintain the strength and endurance needed for daily activities like climbing stairs, carrying groceries, and playing with grandchildren. You might be thinking, I'm not an athlete. But every time you get up from a chair without using your arms, walk upstairs without getting winded, or carrying groceries without strain, you're performing athletic movements. These abilities directly determine your quality of life and independence. Research published in Strength and Conditioning Research in 2018 shows that baking soda buffers lactic acid buildup in muscles, delaying fatigue and allowing longer exercise sessions. For seniors, this means being able to do more activities with less exhaustion. Mix 1/4 teaspoon baking soda in 8 ounces of water. Drink 60 to 90 minutes before exercise. Start with lower dose to assess tolerance. Never exceed 1/2 teaspoon per day. Some people experience stomach upset. Start with a smaller amount and always take on an empty stomach. If you have high blood pressure or heart conditions, consult your doctor first. This isn't just for gym workouts. Use it before gardening sessions, house cleaning days, long shopping trips, playing with grandchildren, travel days with lots of walking. Frank, a 69-year-old retiree, was getting exhausted halfway through his daily walks. After implementing this protocol, he extended his walks from 15 minutes to 45 minutes and started hiking with his retirement group again. He says it gave him back years of active living. But if you think that's remarkable, the next technique could literally save your life. Number 5. Support kidney function and potentially slow the progression of chronic kidney disease. This is where we move from comfort improvements to life-saving interventions. Chronic kidney disease affects nearly 40% of adults over 65, and most people don't know they have it until it's advanced. When your kidneys fail, you face dialysis or death. But here's what most people don't know: there's a simple intervention that can slow kidney disease progression by years, giving you more time with family and maintaining quality of life. A landmark 2009 study published in the Journal of the American Society of Nephrology followed chronic kidney disease patients for 5 years. Those who took sodium bicarbonate therapy had significantly slower disease progression and were less likely to need dialysis. This must be done under medical supervision, but here's how it works. Doctors typically prescribe 1/2 to 1 teaspoon of baking soda daily. Taken with water between meals. Regular blood tests monitor kidney function and electrolyte balance. Dosage adjusted based on individual response. As kidney function declines, acid builds up in your blood. This acid accelerates kidney damage, creating a vicious cycle. Baking soda neutralizes this acid, breaking the cycle and protecting remaining kidney function. Never attempt this without medical supervision. Too much sodium can worsen high blood pressure and heart conditions. Your doctor needs to monitor your electrolyte levels and adjust other medications accordingly. If you've been told you have kidney disease, don't despair. This therapy has helped thousands of seniors avoid or delay dialysis. Print out the research I'm mentioning and discuss it with your nephrologist. My own father was diagnosed with stage 3 kidney disease at age 74. His nephrologist started him on bicarbonate therapy, and 3 years later, his kidney function has remained stable. Without this intervention, he might already be on dialysis. The next technique addresses pain that affects 8 out of 10 seniors. Number 4. Reduce arthritis, inflammation and joint pain naturally. If you're over 60, there's an 80% chance you're dealing with some form of arthritis pain. This isn't just about discomfort. Arthritis pain changes how you move, what activities you can enjoy, and ultimately, your independence and quality of life. I know many of you watching this have given up activities you once loved. Maybe you stopped gardening because your hands hurt too much. Perhaps you avoid social gatherings because walking is painful. Or maybe you've stopped playing with your grandchildren because getting up and down from the floor is agony. Here's what most people don't understand about arthritis: it's not just wear and tear on joints. It's chronic inflammation throughout your body, and this inflammation accelerates aging and increases disease risk. A 2018 study published in the Journal of Immunology made a groundbreaking discovery. Researchers found that baking soda can shift your immune system away from inflammation and toward healing. It literally tells your body to stop attacking itself. Mix 1/2 teaspoon baking soda in 8 ounces of water. Drink once daily, between meals. Take for 2 weeks, then take a 1-week break. Monitor how you feel and adjust timing. For localized joint pain, mix 3 tablespoons baking soda with just enough water to make a paste. Apply to painful joints. Leave on for 20 minutes. Rinse with warm water. Use 2 to 3 times weekly. This isn't a miracle cure that works overnight. Most people notice reduced morning stiffness within 2 to 3 weeks, and significant pain reduction within 6 to 8 weeks of consistent use. Margaret, a 73-year-old artist, had rheumatoid arthritis so severe she couldn't hold a paintbrush. Her rheumatologist approved this protocol alongside her medications. Within 2 months, she was painting again. She recently had her first art show in 5 years. This works beautifully with prescribed arthritis medications and may allow some people to reduce medication doses under medical supervision. Now we're getting to the techniques that can provide immediate relief for daily discomfort. Number 3, eliminate persistent fungal infections that conventional treatments can't touch. Many seniors struggle with recurring fungal infections that seem to come back no matter what medication they use. Yeast infections, skin fungus, and nail fungus become more common and harder to treat as our immune systems age. I know how frustrating this is. You spend money on expensive antifungal creams, take prescription medications that may have side effects, and just when you think the infection is gone, it comes back worse than before. Most antifungal treatments only address the symptoms, not the underlying pH imbalance that allows fungus to thrive. As we age, our body's natural pH balance shifts, creating the perfect environment for fungal overgrowth. Fungi thrive in acidic environments but cannot survive in alkaline conditions. Research shows that maintaining proper pH balance prevents fungal infections from taking hold and eliminates existing infections more effectively than topical treatments alone. Internal pH balancing. Mix 1/4 teaspoon baking soda in 8 ounces of water. Drink twice daily between meals. Continue for 4 weeks during active infections. External treatment. Create baking soda paste, 3:1 ratio with water. Apply to infected areas. Leave on for 15 minutes. Rinse and dry thoroughly. Repeat twice daily. Prevention protocol. Weekly baking soda baths, half a cup in warm water. Maintain internal pH with 1/4 teaspoon twice weekly. Keep skin dry and well ventilated. Consistency is everything. Most people quit after a few days when they don't see immediate results. Fungal infections take 4 to 6 weeks to completely eliminate because you need to eradicate the fungus living deep in skin layers. David, a 71-year-old diabetic, had toenail fungus for over a decade. Multiple medications failed, and his podiatrist was considering nail removal. After 8 weeks on this complete protocol, his nails were clear for the first time in years. His podiatrist was amazed and is now recommending this approach to other patients. The next technique provides immediate relief for one of the most common senior complaints. Number 2, eliminate heartburn and acid reflux quickly and safely. Over 60% of seniors suffer from frequent heartburn, and it's not just uncomfortable, it's dangerous. Chronic acid reflux can lead to esophageal damage, difficulty swallowing, and even increase cancer risk. Most people think heartburn is just an annoyance, but here's what your doctor might not tell you: chronic acid reflux damages the protective lining of your esophagus. Over time, this can lead to Barrett's esophagus, a precancerous condition that affects thousands of seniors every year. As we age, the muscle that prevents stomach acid from backing up into the esophagus weakens. Medications we take for other conditions can make this worse. Even healthy foods can trigger heartburn in seniors when they never did before. Mix 1/2 teaspoon baking soda in 4 ounces of water. Drink slowly over 2 to 3 minutes. Relief typically begins within 5 minutes. Never exceed 3 times per day. Never use for more than 2 consecutive weeks. The prevention strategy. Take 1/4 teaspoon in water 30 minutes after meals. This prevents acid buildup rather than treating it after the fact. Use only as needed, not daily long-term. For persistent reflux, mix 1/2 teaspoon baking soda with 1/2 teaspoon apple cider vinegar in 8 ounces of water. The combination neutralizes acid while supporting digestion. Use under medical supervision for chronic conditions. Critical safety warnings. Never take with calcium carbonate antacids. Avoid if you have high blood pressure, kidney disease, or heart problems without medical approval. Can interfere with certain medications, check with your pharmacist. Lifestyle integration. Take 2 hours after meals to avoid interfering with digestion. Keep emergency mixture prepared for sudden attacks. Track triggers to prevent future episodes. Eleanor, a 77-year-old grandmother, couldn't sleep lying flat due to severe nighttime reflux. She was propping herself up with 4 pillows and still waking up choking on acid. Within 1 week of using this protocol, she was sleeping normally for the first time in 3 years. Work with your doctor to potentially reduce acid-blocking medications as your symptoms improve. Many seniors have been able to eliminate or reduce their prescription antacids under medical supervision. And now, we reach the most important technique, the one that could literally transform your oral health and overall well-being. Number 1, transform your oral health and potentially add years to your life. If you only do one thing from this entire video, make it this technique. Poor oral health in seniors isn't just about bad breath or dentures. It's directly linked to heart disease, stroke, diabetes complications, and even dementia. Here's something that will shock you: the bacteria in your mouth can travel through your bloodstream and cause heart attacks. The Journal of Periodontology found that seniors with gum disease are 70% more likely to develop coronary artery disease. After age 60, everything changes in your mouth. Saliva production decreases, leading to dry mouth. Medications cause further oral health problems. Gum recession exposes tooth roots. Existing dental work begins to fail. Immune system changes allow harmful bacteria to flourish. Daily tooth whitening and plaque removal. Mix 1 teaspoon baking soda with a few drops of water to make a paste. Brush gently for 2 minutes, focusing on gum line. Rinse thoroughly. Use 2 to 3 times per week, not daily. Bacteria-fighting mouth rinse. Mix 1/2 teaspoon baking soda in 1/2 cup warm water. Add 1/4 teaspoon salt. Swish for 30 seconds twice daily. This neutralizes acid and kills harmful bacteria. Deep cleaning protocol for dentures. Soak dentures in baking soda solution, 2 tablespoons per cup of water, for 15 minutes. Brush with baking soda paste. Rinse thoroughly before wearing. Eliminates odor-causing bacteria and whitens. Multiple studies, including research published in the Journal of Clinical Dentistry, show that baking soda removes 5 times more plaque than regular toothpaste. Neutralizes acids that cause tooth decay. Kills bacteria that cause gum disease. Whitens teeth without damaging enamel. Never use baking soda daily, it can be too abrasive. Use soft bristled toothbrush only. If you have sensitive teeth, dilute further or use less frequently. Stop immediately if you experience increased sensitivity. The transformation timeline. Week 1, fresher breath and cleaner feeling. Week 2, visible plaque reduction. Week 4, noticeable whitening. Week 8, significant improvement in gum health. Week 12, professional level results. Patricia, an 82-year-old widow, was so embarrassed by her yellow, stained teeth that she stopped smiling and avoided social situations. Her dentist said her teeth were too damaged for professional whitening. After 3 months using this protocol, her teeth were whiter than they'd been in decades. She joined a senior hiking group and started dating again at 82. Share this protocol with your dental hygienist. Many dental professionals now recommend baking soda as part of comprehensive oral care for seniors. It can reduce the frequency of expensive professional cleanings and extend the life of existing dental work. Now let me share the critical safety information that could prevent dangerous mistakes. Before you rush to your kitchen cabinet, we need to talk about safety. Baking soda is powerful medicine, and like all medicine, it can be dangerous if used incorrectly. Who should not use these techniques? High blood pressure. If you're on blood pressure medication, the sodium in baking soda can interfere with your treatment. Never use internal protocols without medical approval. Kidney disease. Your kidneys process sodium, and damaged kidneys can't handle the extra load. This could worsen your condition or cause dangerous electrolyte imbalances. Heart conditions. Extra sodium can strain your heart and interfere with heart medications. Always consult your cardiologist first. Pregnancy and nursing. While rare in seniors, if you're pregnant or nursing grandchildren, avoid internal use. Medication interactions. Baking soda can affect absorption of many medications, including blood thinners, diabetes medications, antibiotics, heart medications. Start small, always begin with half the recommended dose to test your tolerance. Timing matters. Take internal doses 2 hours away from meals. Take 2 hours away from medications. Never take with calcium carbonate antacids. Maximum dosages. Internal use. Never exceed 1/2 teaspoon per day. External use, no limits for topical applications. Duration, take breaks every 2 weeks for internal use. Warning signs to stop immediately. Swelling in hands, feet, or ankles. Unusual fatigue or weakness. Changes in urination. Severe stomach upset or nausea. Dizziness or confusion. Muscle weakness or cramping. Print out this information and bring it to your next doctor's appointment. Most physicians are familiar with sodium bicarbonate therapy but may not think to suggest it. Ask specifically about which techniques are safe for your specific conditions. How to monitor for side effects. Whether you need regular blood tests. How to adjust your other medications. If you experience chest pain, severe shortness of breath, or confusion after using any baking soda technique, seek immediate medical attention. These could be signs of electrolyte imbalance or other serious complications. Remember, natural doesn't always mean safe. Respect baking soda as the powerful medicine it is. Now that you understand both the incredible benefits and important safety considerations, let's talk about how to implement these techniques in your daily life. Don't try to implement all 12 techniques at once. That's a recipe for overwhelm and potential mistakes. Instead, follow this proven progression. Week 1 to 2, external applications only start with techniques that pose the lowest risk. Natural deodorant, technique number 12. Canker sore rinse if needed, technique number 11. Antifungal paste for skin issues, technique number 7. This allows your body to adjust and helps you gauge your sensitivity to baking soda. Week 3 to 4, add oral health protocol. Begin the comprehensive oral health routine, technique number 1. Start with once per week and gradually increase. Monitor for any tooth sensitivity. Week 5 to 6, introduce internal use if you've had no adverse reactions and have medical clearance. Start with heartburn relief as needed. Technique number 2. Begin with 1/4 teaspoon instead of 1/2 teaspoon. Use only when symptoms occur. Week 7 to 8, advanced applications for those with specific conditions and medical supervision. Arthritis protocol, technique number 4. Exercise enhancement, technique number 6. UTI support when needed, technique number 8. Every senior is different. Your ideal baking soda routine should be based on your specific health challenges, current medications, overall health status, response to initial trials. Keep a simple journal noting which techniques you're using, dosages and timing, symptoms or improvements, any side effects, questions for your doctor. The key to long-term success is integration, not perfection. Set reminders on your phone. Prepare mixtures in advance when possible. Keep supplies in convenient locations. Share your journey with family or friends for accountability. Remember Margaret, who I mentioned earlier. She started with just the natural deodorant because she was afraid of doing anything internal. After seeing how well that worked, she gradually added the oral health protocol, then the arthritis management. 18 months later, she's using 8 of the 12 techniques regularly and says she feels better at 74 than she did at 65. Using too much too soon. Mixing with incompatible substances. Ignoring warning signs. Not consulting healthcare providers. Expecting instant results. Using daily when intermittent use is recommended. The most important thing is to start somewhere. Even if you only use one technique successfully, you'll be healthier and more comfortable than you are today. Before we wrap up, let me address the most common questions I receive about these techniques. Is baking soda really safe for seniors? When used properly and with medical guidance, yes. Baking soda has been used medicinally for over 100 years. The key is proper dosing, timing, and medical oversight for internal use. How long before I see results? This varies by technique. Heartburn relief. 5 to 10 minutes. Oral health improvements, 1 to 2 weeks. 2 to 4 weeks. Arthritis pain reduction, 4 to 8 weeks. Systemic changes, 8 to 12 weeks. Can I use this with my current medications? This depends on your specific medications. Always consult your pharmacist or doctor. Some medications require spacing, others may need dose adjustments. What type of baking soda should I buy? Use only pure sodium bicarbonate. Avoid baking soda with added ingredients. Arm & Hammer pure baking soda is widely available and appropriate for these uses. How much will this cost? A box of baking soda costs under $2 and will last months for these applications. Compare that to prescription medications that can cost hundreds of dollars monthly. What if I forget to take breaks from internal use? Continuous use can lead to electrolyte imbalances. Set phone reminders for your break weeks. If you forget and use continuously for more than 2 weeks, stop for at least 1 week before resuming. Can I teach these techniques to other seniors? Absolutely. Share this video with friends and family. However, remind them that everyone needs to check with their own healthcare providers before starting any new health protocol. What if my doctor doesn't know about these uses? Many doctors aren't familiar with natural applications of common substances. Bring printed research, I can provide links in the description, to help educate your healthcare team. We've covered an incredible amount of life-changing information in the past hour. Let me quickly recap the 12 techniques that can transform your health naturally. Quick recap, 12. Natural deodorant for sensitive skin 11. Canker sore healing 10. Cold and flu symptom relief 9. Gout management 8. UTI support 7. Antifungal treatment 6. Exercise performance enhancement 5. Kidney function support 4. Arthritis pain relief 3. Advanced fungal infection elimination 2. Heartburn and acid reflux relief. Comprehensive oral health transformation. You now have access to safe, effective, scientifically backed techniques that can improve your quality of life, reduce your dependence on expensive medications, and help you maintain your independence as you age. But knowledge without action is worthless. I challenge you to choose one technique that addresses your biggest health concern and commit to trying it for the next 2 weeks. I want to hear about your results. In the comments below, tell me which technique you're going to try first. What health challenge you're hoping to address. Your biggest concern about getting started. I read every comment and respond personally. We're building a community of seniors who are taking control of their health naturally, and your success story could inspire thousands of others. If this video has helped you understand new possibilities for your health, please share it with other seniors in your life. Whether it's your spouse, siblings, friends at church, or neighbors, everyone deserves to know these techniques. Hit that like button if you found value here, and subscribe with notifications turned on so you never miss health information that could change your life. Remember, aging doesn't have to mean accepting pain, discomfort, and declining health as inevitable. You have more control over your health and quality of life than most people realize. These techniques have helped thousands of seniors reduce pain, improve their daily comfort, and maintain their independence longer. You can be next. Thank you for spending this time with me today. Thank you for taking your health seriously. Thank you for being part of a community that believes we can age with dignity, comfort, and vitality. Your golden years can truly be golden. Start today, start small, but start. Your future self will thank you. Until next time, stay healthy, stay independent, and remember, you're never too old to feel better than you do today.